Hi, welcome to the Lisa Saunders Show. I'm Lisa Saunders, and I have with me Dr. Joanne Z. Moore, and I've had you here several times because we talk about topics of interest to me, especially physical therapy, widowhood, but today we're going to talk about physical therapy because you're a physical therapist.
That's right.
And I was really excited about what you wanted to talk about, which is walking, and that is the only exercise I do. I don't go to the gym, I don't do anything else, I like to walk. And I've injured myself a couple times walking improperly and needed to see a physical therapist. So, can you help us to not need a physical therapist, and then if we do need one, what we should do? So anyway, just tell us what you do in your background.
Okay, well, as you said, I'm a physical therapist. I went to Quinnipiac University in Hamden, and I've been practicing now.
That's Hamden, Connecticut.
Yeah, and I've been practicing for 42 years. And I'm in private practice in East Lyme at Shoreline Physical Therapy, and we treat a wide variety of diagnoses. We treat people with a wide variety of diagnoses, and one of the most popular ones is foot problems. You know, from the time we were little, has she taken her first steps yet? Walking is so vital to our life. You know, when you watch a small child, they work at it and work at it and work on it. They stand up, they walk, they fall, they get up, they do it again. They're relentless in their efforts to learn how to walk.
Now, a lot of people don't walk. I mean, some kids, my daughter walked at 10 months old, my first one, but my mother said she didn't walk till she was 18 months old.
Right.
Is there a big range?
There's a wide range of normal, and it often has to do with our connective tissue, how floppy we are. And this is maybe a little off the topic, but our connective tissue has some rigidity to it and some elasticity to it, so that when I bend my finger back, the rigidity, the collagen stops me from going too far, but the elastin allows me to go this far.
Is this why you're a doctor? Because you're starting to
get
way above me.
Right. So, but children who have lots of elastin are very flexible and maybe even a little floppier, and so they're going to walk a little bit later where they have to get more muscle strength.
Okay.
But kids who tend to be sturdier may walk earlier.
Okay, so I love some of these questions you gave me to ask you, and I'm glad though, because I wouldn't have known to ask some of them because, like I said, I do have foot problems. So I want to get this straight for everybody, so everybody can start with a good beginning. Is it better for a toddler to go barefoot or to wear shoes?
That's a great question, because nowadays a lot of families are having everybody barefoot in their house. As soon as they walk in, they take their shoes off and they're all walking barefoot. Personally, I think it's better to wear good shoes.
Really? So when you wake up in the morning,
Put a
don't
slipper
walk around
on.
in slippers all day?
For a few minutes, it's all right. I think it's better to have support.
All right, and how do you know you're going to get good support for your child and for you?
There should be a little bit of an arch support in it for a small child.
Like you're talking about that little bump in the middle. So you need to see that bump to know that you're getting a decent shoe.
And all children will look flat-footed because there's a fat pad on the bottom of the foot. So all babies and toddlers will appear to be flat-footed, but that's not really the bony arch. There's a fat pad there initially. And all the little tarsal bones in the middle of the foot across here are cartilage in babies and young children. And so they ossify and become solidified before the age of 8. So think of them as the texture of a hard modeling clay. And so if you compress them a little bit and allow the foot to flatten, that's how they will solidify and ossify.
So that's why it's really important to have good shoes even when you're little, and because you always want to save money because you think they're going to outgrow this in a couple months, or I don't know how fast, I don't remember how fast kids grow, but you should still look for a good shoe.
Yeah.
Okay, that's good to know. It's shoe or sneaker or just anything with traction, or doesn't it matter? I mean, with traction, of course.
I think a shoe should be sturdy enough so a child can run and jump and play and be safe, climbing up jumping down.
Okay. When should we consider using orthotics? Now, twice I have had plantar fasciitis, and I notice that I get them when I've been walking a lot and not wearing good shoes, like walking my dog, wearing flip-flops, or just shoes without good support, not even really thinking about it. It's just because I want to wear sandals.
Right.
And I notice that suddenly I can't get out of, like when I get out of bed in the morning, I'm in agony when my feet touch the floor.
You're a classic case.
So, what should I have done to prevent that?
Okay, so plantar means the bottom of the foot. Fascia is a white connective tissue. Have you ever brought a flank steak and you saw that white connective tissue on the top of the flank steak? It's very tough.
Yes.
You have to cut off, that's fascia.
Okay.
So fascia is white. It's like a girdle that holds all of our tendons up. So it's under the skin. The skin's a little bit loose. Under that is the fascia. And the fascia is a very tight band that holds everything in place for us. But, like I said, it's white, which means it does not have a blood supply. So when the arch collapses.
And that's what's happened when I'm wearing flip-flops or something to walk the dog in?
Correct. So when the arch collapses, the fascia tears. During the night, it starts to heal, starts to mend. And when you stand up in the morning and put all your weight on it, you rip what just healed during the night.
I was wondering why the agony was worse in the morning.
That's why it hurts so much, because you're ripping what just got healed during the night. And so what you want to do if you have plantar fasciitis is as soon as you get out of bed, put your feet right into a good shoe with a nice arch support, and don't ever go barefoot until it's healed.
I don't know that I was given that tip.
Yeah. You're more prone to get plantar fasciitis if your heel cords are tight, if the calf muscle is tight. So I can show you how to stretch a heel cord if you'd like.
Yes, because
You
it's important.
just stand. So I'm going to stretch this one.
And this is what you should do in the morning or before you go for a walk, or when do you?
No, you always stretch when you're warm. Think of your muscles as a stick of gum. You don't want to stretch it when it's cold because it'll snap. You always want to stretch a warm muscle.
So how do you get it warm?
By walking
So
or
you
by
start-
a half bath.
So you start with a walk, then you stretch?
Correct.
Oh my gosh.
Yep.
I should have gone to see. Okay.
Yep. Stretch. You don't do stretching before any exercise.
This is new to me. Okay.
Okay. So we can talk about warm up too, which is
Thank you.
different than stretching.
Okay.
Okay. So the one you want to stretch goes behind you, and you want your foot pointing straight ahead. Some people want to turn it out to the side. Don't do that. Straight ahead, and then lean forward onto the front knee, and let the back of that left leg really stretch. A prolonged stretch is more effective than a quick stretch. A quick stretch will actually make it more tight. So hold it for a full 30 seconds.
Okay.
And if that's difficult, you can hold on to a chair or a fence or something like that. And then coming back, and then do the other leg.
All right. So somebody like me comes to you with plantar fasciitis. What would you do? What's the treatment?
What I want to do is protect it from getting ripped again.
Okay.
So I might tape it with athletic tape and really give you a good arch support.
Like tape the foot?
Yeah.
Like I'd walk out of there
with
my
adhesive tape type thing.
Really? All right.
Of course, it's not exactly adhesive tape, but it's a good strong tape that doesn't stretch. And just hold the arch up for you.
Interesting. Okay. And then what else? Do you make orthotic, or what do you?
We do ultrasound and massage, try to stretch it out.
Okay.
We stretch the heel cord. And we do some exercises. We would take a towel and have you curl
Oh yeah, I remember
and
doing
pull
that
the
as one of
towel in,
exercises.
and that
Okay.
strengthens the flexor tendon muscles
Okay.
in your foot. And we will build a temporary orthotic that's very inexpensive and see how it feels to you.
Okay.
And if it seems to help, that might be all you'd need. If it tends to be a chronic problem, and it can be because, remember, it doesn't have good circulation, it's white. Sometimes we have to build a permanent orthotic. And the way that I like to do that is I lie you on your stomach with your feet off the edge, and I put your foot in proper posture. And then I cast it, and I hold it there in proper posture until it's firm. Then I take it off your foot, and I have like a little slipper that's the model of, and then we can pour plaster of Paris in it, and that makes a perfect model of your foot in good posture. And then we can heat the plastic and make the orthotic custom to your foot.
Oh, this is all right. And I know a lot of people that have chronic pain. It took me about 1.5 years for it to go away.
It's common for it to take 2 years.
2 years. Okay.
I think orthotics and physical therapy can shorten that time to 6 months or less.
Oh, well, that's good.
And depends on how long you've had it.
So it's something that if you've had it for a long time, is it going to take you longer to heal?
Yeah.
I can't tell you. And it seems to be people my age. Is it something when you're getting older?
Yeah, the arches start to fall after years of being stressed.
Okay.
The London Bridge is falling down. It's an old song.
All right, but you don't have to necessarily, because I was afraid to walk when I was in pain, but didn't really.
Well, yeah, you can't walk if you're in pain because it hurts. Then you need alternative exercises, don't you? Because you can't just gain weight because that's going to make your foot worse.
Right.
So you've got
So weight gain is bad for
You
plantar
absolutely have
fasciitis?
to cut your calories because you're not exercising as much. And you want to start something else like swimming or using a rowing machine or more weightlifting, more core work, more yoga.
Right. The dog's not going to like that, but.
I know.
Anyway, so it's just good for people to not get into that situation in the first place.
Right.
So to not get into that situation, are you saying you need to keep your weight down?
And good arch support.
Good arch support, and do those stretches after you've warmed up a little bit?
Very good. You're a good student.
Okay, all right, good.
Well done.
Now, we can move on to other topics because other people have other problems, so I don't want to leave them out. Because I don't have a bunion. I don't even know what one is. But what is a bunion and how do we get them?
A bunion is when your great toe crosses over
Oh my gosh, I tried to get my mother-in-law a shoe and she had feet like that,
right.
So that was a bunion.
Yeah.
How do you get those?
You get those from years of walking funny.
What's walking funny?
When you hit your heel to the ground, it happens so fast that you don't really realize it, but you hit mostly on the outside of your foot first, and then you come into full weight bearing on your foot, and then you roll and push off.
Now, is this the wrong way or the right way
This
to
is
walk?
the right way.
That's the right way.
So that I start here, I roll gradually here, and then I push off. Now, some people are too far out here when they land, and you'll see that the outside of their heel is worn.
Now,
if you look at an old,
you can do to prevent that, to make sure you walk better?
Yeah, but what happens with the bunion is they're so far over here that they need to rapidly come over, and because of the rapidity, they hyper, and now they're pushing off with the side of their great toe.
Wow.
The inside of their great toe instead of with the whole ball of the foot. So that's how the bunion develops. So what we do is I put a little, like that happens to me sometimes. So I put a little wedge of an insert into the shoe, and it's made of felt, and it just doesn't let me whip in so fast.
And how do you get this
It
piece of
slows
felt?
down. You can get them at a good pharmacy in their orthotic department.
Oh, and it's called what?
I call this
Bunion getter ritter, or I mean, what's it called?
I don't think people understand. I think if you're starting to have great toe pain, it's a good idea to put a little medial post in your shoe.
Is it called that when you go to the store?
It's called a medial calcaneal post. Or you can ask your physical therapist.
Okay,
for
what
it.
to do, okay.
I think that they cost about 75 cents, but it prevents the bunion. But you have to start it early on before the bunion actually forms. You have to recognize that you're starting to get some great toe pain.
All right.
And that's when you need to intervene.
So great toe, you're talking about my big toe. If my big toe is hurting, I'm walking funny, and I need to do something about
Intervene before the deformity starts.
Okay.
Because once there's the deformity there, you can either choose to live with it, and a lot of people do, and they live fine with it. But other people have to have a surgery that pulls it back, and then the doctor puts a screw through it to fixate it back into its straight position.
Okay, so it's not hopeless.
Oh, no.
If you've already gotten deformed and haven't done anything about it.
See your podiatrist, and they have some strategies for you.
All right. When should we consider a cane, crutches, walker, or wheelchair? Because I know it's important to keep walking when you can.
It is. And a cane, don't hesitate to use it. Some people say, oh, it makes me look older. But you know, walking in a teetering way makes you look older too.
Right. And plus you could fall and crack your head, and then you're really in trouble.
Exactly. I can tell how old someone is usually by how far apart their feet are when they're standing. So a young lady, will always stand, guys will always stand with their feet apart, but a young lady will stand with her feet together, and she'll feel perfectly balanced and safe. As we get older, they start to come apart. When you see somebody who's 75, 80, they're gonna have their feet this far apart because this is stable.
So why, is it something about age that we start losing our balance?
Absolutely.
Where does balance come from? Like, is that?
It's a complicated question,
is it
but
in your ear fluid or something?
there is the vestibular system, the inner ear. There's vision is involved in balance. The cartilage of all of our joints has sensory nerve endings that help us know whether we're walking on grass or sand or an uneven surface or uphill or downhill, or whether we've stepped on an acorn. You're going to get all that information from some of the cartilage in your joints. As we get older and the cartilage thins and we start to develop some arthritis, we're not getting all that information anymore. And so we're a little slower in our response to the data. We'll eventually get it, but it might be too slow.
All right, so
when you want to use a cane, you should use a cane anytime that you feel a little unsure.
Now, your cane has kind of an interesting foot.
This was the one that I could find.
So I don't necessarily have to have one with a big foot like that?
Absolutely not.
Because there's some that are really cool looking.
There are, and I think that you can go to a medical supply store and find one that you like.
Because some of them have like paintings on them, and I like the wooden ones that look kind of interesting.
And wooden ones can be cut quite easily to your height.
Ah, okay. Oh, that's right. That's a disadvantage of a wooden one. Like here, you can adjust it. But
Right.
The metal one, and the metal one's very light. It's probably lighter than a wooden one.
Right, and I love these handles that are a little more comfortable. The wooden handle is round, and I find it puts pressure
Right.
that I don't like too much. So, you know, that's up to you.
So how do you walk in?
Okay, so if my injured foot is my right foot or my right leg, then I hold it in my left hand because it's normal to walk left hand and right foot. That's a normal way to walk, okay? So I want to be in a tripod like this because if I'm here and somebody hits me from the front, it's hard, I'm more likely to fall backwards. So this way, if I get bumps from the front, I'm steady in all directions.
Right.
So a tripod is your sturdiest posture. The cane is my hurt leg's partner, so they always go together.
Okay.
And then my stronger leg can come through. So the cane and the injured foot, and then the left leg comes through. So that my walking is actually quite normal. So it's right foot, left foot, cane and right, so that they just go together like that. Then when you go to sit down, you make sure that you can feel the chair behind you before you start to sit. A lot of people, when they're getting close to that chair, they're sitting before they're there, and a lot of people fall right there in front of their chair. So make sure you can feel the chair behind, and you put one hand back on the arm of your chair and then sit.
Now, why is it so important to walk? Like, what if you really love your chair?
Oh, I know. Chairs are wonderful, aren't they? They're always there for you.
Why is it important to walk?
Walking is important for mental health, first of all.
Really? It affects your mental health?
Absolutely.
How is-
Because when
why?
you start to walk, you produce endorphins, which is our natural morphine compound. It's a natural opium, and it elevates our mood.
Wow.
So that's why when runners get hurt, they're so depressed. Or when athletes are out, they're angry. They are feeling this decline in the endorphins that you get when you exercise regularly.
Oh, that's interesting.
So you also get your outdoor vitamin D, your sunshine, you sleep better when you walk. It helps us to keep our weight down. It helps us with bone density.
Now, do you believe everybody has apps on their phones now so you can make sure you get 10,000 steps? Is that what you recommend?
That's common now. I'm not so scientific about it. I think if you walk 20 to 30 minutes, that's
Okay.
good, because different ones of us are going to walk at different speeds.
Now, it's not only mental health, but my daughter was a quadriplegic, and she's always getting pneumonia,
Absolutely.
scoliosis. I mean, that's probably because she wasn't
Absolutely.
walking, right? So-
Absolutely. The scoliosis for sure if you're in a wheelchair for a long time. Pneumonia, constipation, bed sores even. These are serious conditions.
Right.
Walking is really important. Plus it helps you to be more independent in your activities of daily living so that you don't need as much help. You can stay in your own home longer if you exercise and walk every day.
So you think 20 to 30 minutes a day? Okay.
As exercise, plus your functional walking.
Right. So you don't get to count your.
I don't count household walking unless you're quite elderly.
Then you get
And
to
that's the best that you can really do.
Right.
But for most of us who are community livers, I think outdoors 20 to 30 minutes a day is pretty reasonable.
Yeah, well, it
You
is.
can take off 1 or 2 days a week if it's raining or icy or something like that and do something different. Do a different kind of exercise.
Well, I love having that time to be on the phone to make those calls because I hate making a call just sitting there. So that I use
Okay.
that my walking time to make a call.
That's great. Yeah, absolutely.
Call my mother.
Yes, she'll be happy.
Or do you listen to books on tape? Do you walk? Is that your exercise? Or do
I
you do other
don't.
things?
I do lots of things because I love to exercise. So I do the gym 4 days a week.
Oh, you do?
And I hike. I try to get out in the woods.
Do you hike in these shoes?
Oh,
I mean, we got to talk about your shoes.
I did bring a selection. Do we have time to talk about shoes?
I'm not sure. So let's just start.
Okay.
They'll let us know when we have to
Okay.
wrap it up. And actually, we have 5 minutes. So, show us a shoe or two.
If I have 5 minutes, there's nothing I'd rather do than shop for shoes.
Okay.
Okay, so chances are you know whether you have a high arch or a flat foot.
How do you know that?
Well, you get your foot wet, and then you stand on a stone surface, like outside your pool, and you step off and you look. If you can see your whole foot, you're flat-footed. If you see just the ball of your foot and then the heel, that means you're high-arched.
Oh, you're either flat-footed or high-arched? You're
Right.
not- there's nothing in between?
And there's a course in between.
Okay, but anyway.
Now
so-
your foot has to serve 2 functions. It needs to be a rigid lever off of which we push, like a starting block, and it has to be like the bottom of a rocking chair so that you can get your other foot over. So if you have a high arch, you're very good at the rigid pushing off. So you're going to be a good sprinter.
Oh, there's different.
It helps you
different-
choose your sport. What kind of foot you have helps you choose what kind of sport you should play.
Really?
And then somebody with a flat foot is very good at rolling over it, but they stink at pushing off because it's floppy. It's just a floppy foot. So they're going to be better swimmers or crew members on rowing, stuff like that.
Okay.
If you want to be a sprinter, you should have higher arches.
All right.
Now, you want your shoe to be the opposite of what you are. So if you have a rigid high arch, then you want a shoe that's going to give easily. So when you go to the store to buy your shoe, clap it like this and see if it bends.
So you really do have to do that standing on the wet stone. I mean,
well, just once to know.
I feel like I have to go do that.
So this is for someone with a high arch, they can use this. Okay, someone who has a flat foot and needs the rigidity, see, I can't budge that. This is a rigid last.
So flat feet need rigid shoes.
Correct.
Okay. This almost seems like a punishment to have rigid shoes.
No, because they feel so good when they're so supportive.
Oh, do they?
I wear these to hike even though I have a high arch.
Okay.
Because it gives me more security, more support.
All right.
Yeah.
Now, what are these? Come on. These are like the sneaker high heel. You gotta tell us
It's for
what this
country line dancing. A little bit of a heel makes us look more attractive, right? Everybody wants to be in the high heel. But what it does to your back is it arches you a little bit.
Is that good or bad?
Well, if you have a disc problem, it's good. If you have a stenosis problem, it's bad. So you need to know your back.
Wow.
Right,
That's a lot to know.
just like different shoes are good for different feet, different shoes are good for different backs.
Okay.
So,
All right, we have 2 minutes left, so you have to at least tell me that shoe quickly, and then we'll say goodbye.
This was for my country line dancing. It's
like,
just a fun
Can you
kind of
actually
a shoe.
dance in it, though?
Absolutely.
Okay, because I can't imagine dancing in this.
Of course.
All right, well, that's good to know.
It's
Is there anything
fun.
else you wish you had told us?
Be observant of your feet because they can influence your capacity to walk.
Well, you taught me a lot that I didn't know, and I thought I would have known some of those things since I had seen a foot doctor about my problem. So, Joanne, thank you so much. And I do have to come over and get some new orthotics because I lost mine.
Absolutely. You come right over. I'll fix you up.
Thank you so much. And thank you for joining me on the Lisa Saunders Show. And I hope you take a walk this week and every day.
Every day.